Hi everyone, today I'm presenting an IRB proposal about the link between vitamin D deficiency and obesity. A quick overview of vitamin D. It is a fat-soluble vitamin that's stored in adipose tissue. The recommended daily allowance is 600 milligrams for children and adults and 800 milligrams for adults who are 70 years old and older. It can be obtained through vitamin D-rich foods such as wild mushrooms, fortified dairy products, egg yolks, and fatty fish. You can also get vitamin D through sun exposure. There's a steroid that's present in our skin that when it comes in contact with UVB light rays, it actually converts to vitamin D. You can also get vitamin D through a vitamin D supplementation, such as a vitamin, a gel capsule. Vitamin D allows for calcium and phosphorus absorption, strong muscles. It helps with the structure of our muscles, cell production and turnover, and it also protects heart function. So vitamin D deficiency occurs when there is a level of 25 OH vitamin D level of 30 or less. Deficiency can cause issues with bone health. You can get rickets or osteomalacia or osteoporosis. The symptoms of this are bone pain, joint pain, difficulty standing, walking, risk of falling, risk of breaking bones, things like that. Vitamin D toxicity can occur with overconsumption of vitamin D supplementation specifically. Toxicity leads to calcification of soft tissues such as kidneys, heart, lungs, blood vessels. It actually calcifies those tissues, and this can lead to hypertension, headaches, seizures, renal dysfunction, heart damage, coma, and even death. We're looking at the relationship between vitamin D deficiency and obesity. So a quick overview of obesity. It is a global health epidemic. It's the 5th leading cause of death and contributes to approximately 4 million deaths worldwide. It's a major contributor to chronic diseases such as type 2 diabetes, hypertension, cardiovascular disease, and it's calculated using BMI, which is a body mass index, which is calculated using somebody's height and weight. A BMI of 25 or higher is considered overweight, and a BMI of 30 or higher is considered obese. Obesity can be treated with a combination of behavior modification, diet, exercise, medication, and sometimes bariatric surgery. There is a link between vitamin D and obesity. Those who are overweight or obese have a higher likelihood of having a vitamin D deficiency. A couple reasons for this have been explored. Some studies have claimed that those who are obese are maybe getting lack of sun. They're maybe not doing as many outdoor activities, or when they are, they're wearing more clothing. Or it could be due to a poor diet. These are generalizations, and they have not been grounded in science at all. The reason actually for this link between vitamin D and obesity is actually that vitamin D is a fat-soluble vitamin. It's stored in adipose tissue, and the tissue actually sequesters the vitamin and doesn't release it into the bloodstream at a normal rate. So knowing that there's this link, we want to look at what can be done and what the recommendations can be to reduce obesity and replenish vitamin D. So there's been a lot of current studies out there that have looked at the link between vitamin D deficiency and obesity. There was one study where obese and overweight college students were given calorically reduced diets to follow, and some of the students were supplemented with calcium and vitamin D. Those who were supplemented with these vitamins, they did lose more fat, but there was no overall change to BMI. In study 2, there was a group of postmenopausal women who were overweight and obese who followed a weight loss program that included diet and exercise routines. Some of the women were supplemented with vitamin D, and what happened was everybody lost weight, but what they actually found were that the women who were taking the vitamin D supplementation, not all of them necessarily had their vitamin D levels replenished. So what this shows us is that vitamin supplementation needs really differ per person. There's been some studies that have looked at sun exposure and vitamin D levels as well. There was one study where children with lighter skin Their 25-OH vitamin D levels were looked at compared to children with darker skin. And this is because the melanin in our skin, so higher melanin, which is darker skin, versus lower melanin, which is lighter skin, melanin actually acts as a natural sunblock. And so what this study found was that the kids who had lighter skin, their parents actually used more sun protection measures such as sunscreen or increased clothing, but they still had higher levels of 25-OH vitamin D just because their skin was able to absorb it a little bit better through the sun. There was another study done in Africa where they were finding that 25-OH vitamin D levels were really low despite high levels of sun exposure. But what they found was this was occurring because the exposure was only on the face and hands due to religious practices in that area. And so it really showed that to get adequate vitamin D from the sun, it really needs to be your legs and your arms that are being exposed. There was another study that also looked at older men in Brazil that had really low vitamin D levels. They tried to increase their sun exposure time, but they still were not able to get adequate supplement or adequate levels of vitamin D in their system. This was likely due to their age, though. It's harder for older people, usually 70 and older, to get vitamin D from the sun because their skin actually does not produce the steroid as much as they get older, the steroid in the skin that is mixed with sun to produce vitamin D. So that was the issue in that case. So the proposed problem we have here is that vitamin D deficiency is risky. It can cause a lot of health problems. Obesity is risky and can cause a lot of chronic diseases. And we know that there is a link that those who are overweight or obese have a higher likelihood of having a vitamin D deficiency. So my study looks at potentially some solutions and what can be done about this. We want to find out if correcting a vitamin D deficiency could actually reduce BMI, and then we want to see what the best way is to correct a vitamin D deficiency, if it's sun exposure or vitamin supplementation. And then we want to see what are specific recommendations that we might need for people who are overweight and obese, since we know that it's harder for them to maintain their vitamin D levels. So in my proposed study, we'd be looking at participants who are age 30 to 50 years old with BMIs of 25 or greater to put them in the overweight and obese category. They would have 25-OH vitamin D levels of 10 or lower, so they would be deficient. We would want to make sure that they have no current vitamin D supplementation that they're taking, and that there's no malabsorption disorders or medical interventions such as chemo or dialysis or anything that could interfere. We'd also want to make sure that there's no recent weight loss interventions that they started. So they didn't recently start a new diet or maybe start a new exercise routine. The participants would be recruited from 3 local PCP offices around Biddeford, Maine. The offices would be randomly chosen. What would happen is all the PCP offices would be approached. We would explain the study to them, say that, we would love to have recruit their patients to participate. The PCP's benefit is that if they're chosen, then they get a paid billboard that would be located at the University of New England. So if more than 3 offices agree to be in agree to allow their patients participate, then they'd be placed in a drawing. We would pick 3 random offices to make it fair and randomized. And the PCP would be responsible for assessing to see if the patient actually meets criteria for the study. So the study activities, we would use about 12 weeks. The data collection would occur around the month of June in Maine. This is so that to mitigate risk of sunburn, or obviously we wouldn't want people being out in the cold or anything like that in the winter. What would happen is participants would come to the medical lab at the University of New England and have their 25-OH vitamin D levels drawn and their BMI calculated. Then they'd be placed in one of 2 groups. Group 1 would be instructed that they need to expose themselves to the sun 3 times a week, specifically at noon each time. And group 2 would be given a loading dose of vitamin D supplementation, 800 milligrams a week, to take once a week for 12 weeks. After 12 weeks, participants would come back to the lab and have their 25-OH vitamin D levels and BMI recalculated. The risks of this study is that there is a very small potential for sunburn or vitamin D toxicity, but the benefits are that vitamin D levels could potentially be replenished, all transportation to appointments would be paid for, and participants would also receive a $100 Visa gift card. Confidentiality, we would want to make sure that's maintained. Information would be stored in an electronic medical record, and then it would be destroyed after the study so that none of those records were maintained. Data would be collected from participants, and the participants would be given a randomized subject number so that when the data was analyzed, no personal identifiable information is used. Participants would sign a consent form, and they could have copies of all of their medical records. For our data analysis, the G-Power calculator asks for a participant sample size of 264 participants total. A two-way ANOVA test would be utilized to understand the interaction between the two independent variables. Our independent variables are sun exposure or vitamin supplementation, and the dependent variable, which is the vitamin D being replenished. And we would also use a t-test to utilize to see if there is a correlation between replenishing vitamin D levels and a reduction in BMI. My hypothesis is that replenishing vitamin D could potentially have a little bit of an effect on reducing BMI. I also hypothesize that sun exposure will actually be more effective at replenishing vitamin D levels than the vitamin supplementation group. We learned in the current literature that cutaneous production of vitamin D can occur very quickly. Only 10 to 30 minutes of sun exposure can produce around 300 milligrams of vitamin D. So I propose that that will be more effective than providing a vitamin D supplementation. So this study is important because we know that vitamin D deficiency is dangerous and can lead to health problems, and we know that obesity is dangerous and can lead to chronic diseases. So the purpose of this is to find a way to reduce the risk of both of these. Thank you so much for your time. I hope you take my IRB proposal into consideration. Thank you.